Hematoma, an embarrassing situation for the dentist. Hematoma gives an unesthetic appearance and greatly affect the psychological well-being of the patient. So this video will help you to deal with patients in such situations. First we should know what is hematoma. Hematoma is defined as effusion into the extravascular space. So this means there is abnormal collection of blood outside the blood vessels. It is rare in the palatal region due to the close adherence of the palatal mucoperiosteum to the bone. Actually, the palatal mucoperiosteum has an unyielding nature, so there is no change under pressure. The image showing extraoral and intraoral hematoma. What can be the cause of such hematoma? Damage of blood vessels by the needle during penetration of soft tissue. When there is unintentional nicking of the blood vessels with needle during the injection of local anesthesia, it might result in effusion of blood into the extravascular spaces, which subsequently develops into hematoma formation. By needle pricking, either you puncture vein or artery. Puncture of vein may or may not produce hematoma, but the important part is artery. Artery perforation rapidly increase in size until any treatment is initiated, as there is significantly greater blood pressure within the artery. Also, the size of hematoma depends upon the density of the tissue surrounding the blood vessels. There is high chances of hematoma formation in patients suffering with hematological disorders. Highest risk of hematoma formation is during posterior superior alveolar nerve block, followed by inferior alveolar nerve block and mental or incisive nerve block. Now let's get into prevention. The surgeons should use an appropriate technique of injecting local anesthesia, and they should have a thorough knowledge of normal anatomy and landmarks of the particular region. The injection technique can be modified as dictated by the patient's anatomy. Next, you should keep the number of needle penetration as low as possible, and to minimize the risk of hematoma formation, use short needle especially for posterior superior alveolar nerve block. Management. Without any delay, first you should try to apply direct pressure over the bleeding site for a few minutes. I know it is difficult to apply pressure to the bleeding site due to the location of the involved blood vessels, which are located posterior, superior and medial to the maxillary tuberosity, but bleeding stops or clotting occurs when external pressure on the blood vessels exceeds the internal pressure. Next, you should instruct the patient to apply ice pack for 30 minutes per hour to resolve the condition, and strictly ask the patient to avoid any heat application as it might increase the size of the hematoma due to vasodilation. Then prescribe the patient analgesics, antibiotics and muscle relaxants. Any dental treatment in the involved region should be avoided until signs and symptoms resolve. Gradually, the swelling and discoloration subsides in 10 to 15 days. Based on my experience, I would like to say we should always inform patient about any possible complication before injecting local anesthesia, as it helps the patient not to lose faith on the doctor.